everyone. Welcome to Superior Health's Fundamentals for a Culture of Continuous Improvement Tele-Echo, and today we are on session 3. My name is Elena Smith, and I'm a Quality Improvement Advisor for Superior Health Quality Alliance. Just first, a couple quick announcements. We are looking for case presenters. If you are interested in presenting a case during a future call, feel free to reach out to me, esmith@mpro.org, or Barb Link at BLINK or blink@mpro.org, and we can walk you through the process. We also want to make sure that we clear some confusion up. We know there are a lot of different educational events available right now, and Superior Health is participating in the AHRQ Nursing Home COVID-19 Focus Echo, but that event is completely separate from this project. Superior Health will continue to host echoes throughout the duration of the contract, so you'll expect to see many more of those over the next few years. But if you intended to participate in the AHRQ Nursing Home COVID-19 Focused Echo, I'm going to ask that you reach out to Andrea Boucher, and I'll put her info in the chat really quickly. It is aboucher@mpro.org. So again, that's if you intended to sign up for the AHRQ Nursing Home COVID-19 Focused Echo. That is a separate project from this echo. To continue, today's agenda will include an introduction. We'll do some participant introductions from our team as well. Then we will do a didactic presentation where we'll talk about team communication, including the patient perspective. And then we will have our case presentation and discussion. We didn't get a case presentation from any of our participants, but Barb created one from Happy Home Healthcare. So we look forward to having some discussion around that. Again, we always want to hear from you. So if you have any interest in any kind of case presentation about quality improvement, we definitely welcome them. So we want to hear from you if there's some kind of process that's working really well that you want to share with others, or if there's a process that you want to start that you're still working out the details that you want to get feedback on, or if you have a project that's kind of stalled and you're reaching some barriers that you want some feedback on. It's really open to whatever your needs are. So for some standard verbal reminders, we're going to have all sessions recorded. So you should have seen last week that I shared the link to session 1. Hopefully we'll have session 2 available within the next day or so we can send that one out to you as well. So there'll be about a week lag on those. We'd also love to see you. So if you do have access to a webcam, please feel free to turn that on. We ask that everyone makes a practice of entering your name and your organization into the chat box when you join the session so that we can record our attendance. It's also helpful to us if you revise how you're identified in the video gallery by clicking on the 3 dots in the upper right-hand corner of your thumbnail, clicking rename, and then type in your name or the name of your organization. If you're not able to find it there, you can find it in the participants section as well by clicking that more button. We also want to remind you to mute yourself when you are not speaking, and remember to unmute yourself and state your name when you're participating. As a reminder, please do not disclose any personal health information during our discussions. If you are having any trouble with Zoom, you can feel free to message me in the chat and I can help you out with that. If you have any other questions, feel free to message Barb, who will be monitoring the chat throughout the call. Please help us foster a positive learning environment when asking questions and making comments. Remember that we are all here to learn from each other. So since it's been a couple weeks since we last met, let's go ahead and do some introductions again today. Just helps us get to know who's in the room. Maybe you want to collaborate with someone on a project or learn about what they're doing a little bit more. So with that, I will call on everyone. So first up is Kimberly Jamaro.
Hi.
Hi.
Health Senior Services.
Thank you. And one other thing, we'll ask a little fun question at the end. Is there a specific appetizer or dessert that you look forward to over the holiday season? And what is it? Oh, you're on mute now. I asked it too late.
Well, something I haven't had time yet to make this year. I make little teeny tiny kalachki.
Oh, thanks for sharing that. Next up is Natalie Matthews. Or Mike.
There you go. All right. I'm Natalie Matthewson. I am with Central Minnesota Council on Aging. I'm the Community Development Supervisor. We've worked with 14 counties in the central and east part of Minnesota. Something that I look forward to during the holidays. Did you say an advertisement too? Or something, or just food, or
honestly, it can be whatever you look forward to during the holiday season. I just immediately go to food. So
yeah. We did bake some cookies the other day, but what I thought of an advertisement, I love the Folger commercials that they put out every year. I don't drink Folgers coffee, but I love the Folger commercials that they put out every year. But baking is always fun too.
Awesome. Thanks for joining us, Natalie. Up next is Justina.
Oh, hello, Justina. Justina Timer from Town Home Health in Farmington, Michigan. I'm looking to Christmas Eve supper. We have traditional 12 dishes. It's been going on forever, and it's my favorite dish in the entire year.
Oh, that's great. Something to look forward to for sure. Oh, next up is Kevin. Kevin, if you're speaking, we can't hear you because you're muted. If you have joined by phone, you can press *6 to unmute yourself.
Can you hear me now?
Yes.
Oh, awesome. Very good. I'm Kevin McElroy. I'm the administrator for Mackinac Straits Long-Term Care Unit. I'm just kind of wondering, you mentioned there's a different ECHO project, and I'm noticing I think I'm the only nursing home on here. Am I in the right program?
That could depend. If you are interested in this topic, then this definitely could be the right program. But if you are looking for that AHRQ program, that would be a different one.
Okay. So, but anyway, my favorite, I'm looking forward to iced Christmas cookies.
Great. Good to hear it. I can reach out to you after this, Kevin, if you are looking for that AHRQ one, and I will send you on to the correct person.
Awesome. Thank you so much.
You're welcome. Up next is Maureen McGee. Maureen, if you're talking, we can't hear you. Okay, we will come back to Maureen. What about Alyssa Elliott?
Hi, I'm Alyssa Elliott. I am from Maple Grove Hospital. I'm a clinical effectiveness specialist. And I think I'm looking forward to, well, actually right now I'm celebrating Hanukkah with my family, and I haven't eaten a latke yet. So I'm looking forward to eating one of those soon. And then we celebrate Christmas as well in my family. So I'm looking forward to homemade cinnamon rolls on Christmas morning.
Awesome. That sounds great. Thank you for sharing. Up next, we have Nicole Meyer.
I'm Nicole Meyer. I'm with Good Samaritan Home Care in St. Peter, Minnesota, and I'm the clinical manager and quality control here, and I'm looking forward to eggnog and mulled wine.
Oh, great choice. Yes. Thanks for sharing. Up next, Lauren Martin.
Hi, I'm Lauren Martin, Manager of Clinical Effectiveness in Maple Grove Hospital in Maple Grove, Minnesota. And I love food in general, but I really like triple chip cookies that my husband makes. They've got butterscotch, white chocolate, and dark chocolate chips, and they're so delicious. So he's going to be making those soon, and I'm super excited.
Yum. That sounds excellent. Up next is Margaret Leitner.
Good morning. Margaret Leitner, Vice President of Senior Services in Southeastern Michigan. So we have a location in Dearborn and Farmington Hills. And we have a holiday tradition. My husband makes Christmas pudding, which is a steamed brown bread with raisins and warm lemon sauce over top. And it's a recipe that my grandma used to make. So we always look forward to that.
Awesome. Glad to hear that. Up next is Era.
Hi, this is Erin Wanmacher. I'm from the Care Choice Collaborative in the Twin Cities in Minnesota. And I would say the food I'm most looking forward to here at Christmas is yokaga.
Sounds good. Up next is Claudia.
Good morning, everyone. My name is Claudia Chavez Rhodes. I am the Quality Initiatives Program Coordinator at Upper Peninsula Healthcare Solutions, and I love making good gingerbread house with the kids, so that's always fun for us.
Yeah, that sounds like a lot of fun. Up next is Susan.
Hi, this is Susan Nielsen. I'm an RN working in the quality department at North Memorial Hospital. And my most favorite thing at Christmas time is making homemade butter caramels.
Yum, that sounds delicious. Up next is Karen. Karen, if you're speaking, we can't hear you yet. You might be muted.
She did chat in that she's expecting a new grandchild Christmas Day, so that's pretty exciting.
Oh, there we go. Well, she might have put her info into the chat. So thanks, Karen, and that is very exciting. Congratulations to you. Up next, we have Jody.
I'm Jody Malone with Essentia Home Care in Detroit Lakes, Minnesota. I am looking forward to actually making cookies this weekend with my 4-year-old.
That is always so much fun. Those are some of my happiest memories is doing that with my mom. So I'm sure you're looking forward to doing that. Up next is Joanne.
Good morning, I'm Joanne Sandvik with the La Crosse Medical Health Science Consortium. And this last weekend I made spritz cookies, and I haven't made those in about 15 years. And I feel like I need to put them in the neighbor's garage so I don't eat anymore.
That's always the toughest part. Thanks for sharing. Up next is Taylor.
Hi, I'm Taylor Lilja. I work at North Memorial Health in Robbinsdale, Minnesota. And I'm looking forward, we're going to make sugar cookies and gingerbread cookies this weekend and decorate them with my daughter.
Yeah, that's awesome. Yeah, this weekend's going to be a popular one, I'm sure, for baking. Up next, we have Anna.
Hi there, I'm Anna Pollock from Ascension, Director of Transition Care for the Michigan market. And I am looking forward to a traditional Polish dinner on Christmas Eve.
Excellent. One of our coworkers said that same thing when we asked this question earlier. Up next is, and I might not get this one right, is it Linnea? Linnea, if you're speaking, you might be on mute. Okay, we'll come back to her. Up next is Darlene.
Good morning.
Morning.
Sorry I had trouble getting in, so I was a bit late. I'm with A&D, My Choice Waiver and Transitions, Nursing Home Transition Program. And I am looking forward to just about everything about Christmas. We usually go and look at the lights. Unfortunately, we can't be with as many friends and family this year as everyone is in that, but we'll make the best of it and enjoy what we have.
Great. Thanks so much, Charlene. Up next is Andrea Hayden.
Hi, my name is Andrea Hayden. I'm with the Quality Department at North Memorial Health as well. And my family and I are looking forward to fruitcake as much as we can buy and receive. Thank you.
Awesome. Thanks, Andrea. And then Diane Dome. Diane, if you're speaking, you might be on mute. All right, well, we can come back to Diane. Now we'll go, I don't think I missed anyone, but if I did and you want to unmute yourself, I'll give you a couple seconds really quickly to introduce yourself. Okay, well, now I will introduce some of our team members, starting with Janelle Shearer.
Hi, everybody. I'm Janelle Shearer. I'm based in Minnesota, so I'm a coworker with Elena and Barb. And I'll just tell you my thing. My mouth is watering now listening to everybody else. So I am looking forward to, they're called cream wafers, very light little flaky, buttery cookies. My mom always made for me, so I'll give them, I guess, for myself.
Awesome. Thanks, Janelle. I'll go next and then let Barb go right into her presentation. Again, my name's Elena Smith. I'm from Superior Health, but based in Michigan. Sorry for doing this to all of you other Michigan participants right before lunch. I didn't think about that. But my favorite snack around the holidays is, they're called Devils on Horseback. They're date stuffed with your choice of cheese. We do gorgonzola and then wrapped in bacon. So super simple, but extra tasty. Pop them in the oven at 400 for 15, 20, sometimes 25, depending on how crispy you like your bacon, and you're good to go. So with that, I will hand it over to Barb, who will begin her presentation.
Thanks, Elena. Well, I'm Barb Link, and I'm a quality advisor as well, and I'm out of Michigan. And I like Russian tea cakes. We used to make those every year, and they're just a little dough with walnuts and powdered sugar and just deliciousness. So I'm excited about trying to make those again. You have to make them just right, though. Okay, with that, share my screen. All right, so today is the third installment of our Fundamentals for a Culture of Continuous Quality Improvement. This session is going to be focused on team communication, and that's going to also include a bit about the importance of including a patient perspective as well. So the main objectives for today's session is to understand the difference between communication structures and styles within the quality improvement team, understanding the communication process to gain insight into increasing positive quality improvement outcomes for the whole team, learn how to engage patients as a member of their own care team to increase positive care outcomes. And we'll also talk about other settings and ways that you can include the patient or consumer's voice in the services and care that you provide. So just to break down communication a little bit, well, no, we don't want to break down communication, do we? We want to support communication. So, but to look at it in a few different ways, we'll be talking about structure and all of the different ways that I'm presenting this today. You can look at it as an individual way of increasing communication among your team members, as well as building on layers of communication. because the importance is that you try and figure out the best way to make sure that people are understanding what their roles and responsibilities are and what their tasks are within the team. So there are multiple ways that you can take a look at communication. Of course, one of the easiest ways is two-way communication. That provides the ability to ask questions, and for the two people engaging in that conversation, really to ask clarifying questions and get answers that they need. And that's to provide information on a very direct basis. Then there's also the type of communication that's based on the needs of the organization and the leader. And that usually includes, again, your mission, vision, and values of the organization as a guide. Really, when you're using this type of communication, it uses the organization's strategic direction to understand the needs of the organization as well as the leader. And so it can be really something that you're continuously trying to communicate the overall structure of the organization and make sure that everyone understands that, and really the leader needs to be using that as its main communication tool. And then closing the loop, that's providing meeting agendas with notes, actions, conclusions, dates of importance, follow-up, who's responsible for what and when. Again, this creates a loop of closure that the team will really benefit from, because everybody knows there's teach back component in this, that people are really following up with things and people truly understand they again have another opportunity for asking questions at this point. And so these are just different ways of using communication within a structural way, but many of them are done within one meeting or can be layered onto each other or used like exclusively as well. When you're thinking about communication, it is really important to think of the multiple ways that you can use communication to really drive home your message and get it integrated within your team and within the organization. So if there's something important that your team wants to communicate out farther, thinking about, are there posters in a break room? Are there electronic push alerts that could happen through emails that help people out? I was at one organization that used the vision, mission, and values as a screensaver. So every day I booted up my computer and boom, there was the vision, mission, and values of the organization right there in front of me to keep it right on top of what I was thinking and how I was implementing anything I did that day. So now moving on to communication styles. There are a variety of communication styles that you can use within your organization to really communicate a message depending on what you need to move forward. So there's the top down, which emphasizes a managerial hierarchy. Usually this type of communication style is used when leadership really needs to evaluate how employees are understanding a concept or how how are they moving forward with a typical action. So again, it's sort of your old-fashioned, I have an important message, I'm the leader of the organization, I'm going to tell everybody it's that important that it just needs to be done, very hierarchical top-down. Bottom up tends to be more employees to management, and this provides employees understanding that their needs, values, or perceptions and opinions are important. And many times when you're needing something to be implemented on a frontline basis and really wanting to have engagement, you use your bottom-up strategy. Most lean principles focus on a bottom-up strategy and understand the importance of having that employee input. That's the bottom-up definition. Then diffusion is dispersing something and spreading it from a central point. This tends to be something standard issue that needs to go out to the whole company. I think of when you have your open enrollment for benefits, you're having your central point, your HR person, it's a standardized message. Everybody needs to hear the same thing. That is a diffusion concept of a communication style. Everybody hears the same thing from one point. Then you have spread. That's sort of the propagation of information from one person to another to achieve topic dissemination across the organization. Sometimes leaders use this, it's almost a word of mouth concept, but they might target certain people within the organization who others really listen to, and they have a one-on-one conversation because they really want to have that topic spread on a personal level. And so it can be very informative. Of course, you want those people who are spreading the information to really have a good understanding of what the topic is and how they want it spread. But it can be more personal, and it can happen more quickly when you have one point going to another, and it's on an individual basis. And there can be, again, sort of some of that process where it's two-way communication, where the individual would have ability to ask questions of the person who's one of the point people to spread out the information. I did want to take a minute of the matrixed example, because this is more of a tool of a style of communication. It keeps all the members on the same page, and it ensures no breakdown in processes. I have an example here of what that is. I'm kind of airing a little bit. A long time ago in a far, far away land, I was working on a team that was struggling. There were multiple roles within the team. There were ongoing strategic planning, action items that we needed to do. It was very layered and complex. And people weren't exactly sure who was supposed to be doing what, when. And so what we did was 2 of us sat down and worked on a matrix example. Then we shared it with the team, and they provided input as well. And it was very constructive. It really engaged people and helped them understand. So as you can see, across the top, there are the different roles within this particular team. And it starts high up, even, again, going back to some of the examples from the session I provided last week on outside team members. Like a director and a champion didn't necessarily attend every one of our meetings, but they really were there and could help us move things forward when needed. Then we had certain subject matter experts on different topics within the team, adverse drug event person. We had a community coalition person, and then we had different leads for different areas of community coalitions that we were also team members as well. And then along the side here, you can see ongoing team strategic planning and the different things that we had. We had educational planning. We had a roadmap that needed to be developed. We needed to have a shared calendar for ongoing communication. Then within the grid, all of these letters that are under each person's role are specific things found in the key. And these are standardized roles that they have within a matrixed example. And I do have a link for more information if you want to find out about it. But again, it breaks down, for example, if we look at a community coalition lead here, for this particular topic, they were an I designated to inform, notify after decision or action taken and may require further action. So that person within that role, they just needed to be informed of trainings going on, and then they would have designated actions that they might need to follow up on, but they weren't responsible for all the trainings. So as you can see, responsible to do the task, accountable, ultimately responsible, that tended to be someone who needed to put a stamp of approval on things to get it moved forward. Just a consultant, many times that was our SMEs, as you can see, under our CC SME designated line here. There were certain things for recruitment that we needed to do, and we could consult the SME on who we needed to target for that. And then director approval, that of course mainly fell under our director, really needed to know that certain things like for recruitment, they needed to have that to move forward for our contractual purposes. So it's quite detailed. Can take a long time, but if you have a very complex project, I found this particular tool for communication to be very helpful. So some of these things seem very self-evident, but I think it's important to think about when you're in a team meeting, you have different ways of communicating with people. And there are 2, of course, main processes for communication, your oral communication and your written communication. When you're in a meeting, especially in our virtual world, and we're doing oral communication, it is very important to remember that only a small portion of information conveyed orally is remembered or acted upon. So many times you can see people taking notes while they're in a meeting, or even writing them down. And that's very important when you remember this concept that if you're communicating orally, that really people can't always retain everything that you're saying. So providing agendas, follow-up items, other things that they can do written, now we're moving into the written types of communication, really reinforce what you did and talked about in that team meeting. So when we talk about written information as a way of a communication process, it provides a paper trail. It ensures tracking of what was stated and when. So when you have reports can be very helpful to send out to everyone so they know the high level of what's going on. Emails always have to be open. They can be tracked. Interestingly enough, just the other day, one of our directors did to me a great thing. We ended a meeting and she attached the agenda, but right in the body of the email for follow-up, she said, here are our main action items. Right there, boom, I can open up that email at any time and find out what my action items are and what I needed to follow up with. It just was a time saver and very helpful. So there are a lot of written communication tools in this day and age, and it just reinforces all of the oral communication processes that occurred in a particular meeting. I did want to touch on this too. I think this is incredibly helpful. Many times you're in a team meeting and you have an agenda, but you have a mix of information and communication types going on in that particular meeting. So here are just a few examples of different types of meetings. Now, of course, you can have these mixed together in one meeting, but once you realize what the main topic of your particular meeting is, really to focus on some of those sort of things instead of mixing, because I've been in those meetings where you mix an informational meeting with a discussion meeting with an action meeting, and oh my goodness, that agenda gets so huge that you never get to it, and attendees get very frustrated when you can't get through a whole agenda. So parceling it down, an information meeting, some examples are that of briefings. You needing to present a policy. There's a non-negotiable issue. I think many times people struggle with that, but sometimes there's a deliverable due, and that deliverable has very specific components of it. Just explain it. It's information. It's one-way communication. People can ask questions for clarifying, but it has to be done the way it has to be done. And then certain types of training. You know, you have infection control meeting, very straightforward. It's informational. That's the meeting that it is. There's not a lot of open room for discussion and that sort of thing. Then you do have a discussion meeting. That's where you might have a new project and you're brainstorming about timetables, about what are some of the main action items to get that particular maybe quality improvement project moving forward. Why hasn't it worked before? That's a brainstorming meeting. You're wanting to elicit discussions that have suggestions and input to them. It could be a planning meeting or more of a meeting where there's negotiation taking place. That's more of your discussion type of meeting. And then when you're moving into an action type of meeting, that's where you're really planning for your results. There's group decision-making in this and problem solving, but there's always action going on with that particular meeting. And as you could see, maybe you would even move through some of these. I could see you would initially have a discussion meeting at the beginning of a project, but as it moves along, it turns more into an action meeting. So I just thought that was important for looking at honing in as to the type of meeting that you might be having and really focusing on what are those important points of that meeting and not mixing them together and having this huge agenda. So now to talk a little bit about patient and consumer engagement. It is an integral part of success of any quality improvement project or any organization in general, especially when you're dealing with healthcare or providing social services to a group, that you get that patient and consumer voice involved. So when we think of the level of engagement for patient and families, what we're doing is utilizing the core components of person and family-centered care of dignity and respect, information sharing, participation, and collaboration in assessing and shaping one's processes, and it will help to further shape the culture of your organization and the services that you provide. Now, many people, when they think of patient and consumer engagement, they think of that one-on-one. There's been a really big expansion of direct care and really having the patient or customer involved in decision-making as to what their service might be. There's patient-centered care in the skilled nursing facility. There's the same consumer-centered care with your area agencies on aging and social services. That's sort of your bread and butter of direct care with your patient and consumer. The patient is a partner in decision-making for their care. Decisions are made by the patient's preferences. But when we really look at patient and family engagement on a broader context, that's integrating it also at the organizational level and within policymaking as well. So then taking the next step up, you, in an organizational level, you would involve patients and consumers, family members on advisory councils. Patients could be providing input on surveys about the organization, not just their own personal care, but how things could maybe be done better at an organizational level and the services and care that's provided to everyone. And then looking at it at a policy-making level within your organization, patients are included in policy-making. They can be included in research studies. They can be included in policy councils and even possibly be a co-lead or a member. I really like this graphic very much. It sort of shows a continuum of different ways that patients and family members can be involved at all levels within an organization. And many times when you're doing a quality improvement project, it can be very helpful if you have a patient and family advisor or consumer advisor that you can access to say, you know, this is what we're thinking of. What might we be missing from your perspective? Or we're trying to integrate patient stories into all our education that we're doing moving forward within our implementation of our new contract. It can be very powerful and help people truly understand the issues, challenges, and positive things that happen to a patient or a consumer as they're accessing services in your organization. So again, this is just another way and some different options for thinking of how you can involve your patients, family members, and consumers at the direct care level, organization of care, and policymaking. And I do believe I have a link to this with an article that has further information about it as well. So that's it for today. Anyone have any questions? Hopefully I communicated well today.
Barb, this is Kim. It's been a long time since family members have been permitted into our centers to really, you know, kind of, you know, when they're in our buildings, they kind of see what happens and how it happens. Do you have any suggestions for re-onboarding our families, you know, before we might include them in some of these things?
Well, that's a really great question, Kim. You know, are you talking about even just having some of the things we've had to do with our patient and family advisory council that we're engaging for our new work? We had an onboarding process where we did virtual interviews with each one of them. Then we had an orientation. Are you wondering about them, how they were on an individual basis able to go in and see their family member? And then if they had an issue or concern, there was direct feedback right then, that sort of thing, or a little bit more broad about, say, some patient and family advisory councils? Not quite sure which way you're looking.
Potentially with an advisory council, but also for policy input. You know, it's one thing to have eyes on in the building and one thing to be looking through a window or a virtual visit. So I would imagine there's going to be some re-onboarding that might need to take place just to rebuild some of those relationships.
Well, I would like to reach out to other people attending today and get their thoughts as well. But again, some of the things we did was reach out to family members. We did do individual interviews, sort of acclimating them to some of the things that we're doing. Of course, it's a much broader scale, not as specific as a setting, but we would do individual interviews with them, get their input, their questions, their challenges, and then did a next step of a formal orientation back to our organization, what our goals were, what avenues we had if there were concerns, that sort of thing. And that was one way that we cultivated an advisory council. Again, it was virtual. The people had to have access at least to video conferencing, but we did open up a phone line too. One way we did it. But I'm curious to know about maybe other people's suggestions. I think it's a great question. Or even just your thoughts about how you might have to address it in the future.
This is Nadley Mathewson. I guess the question would be is what is happening now as far as engaging family members? I know a number of facilities have used, either phone calls or been able to get do Zoom calls and things like that. So I guess that's a question of what's happening now as far as engaging family members. I know that they can't see their family member that's living in the facility in person, but is there, I'm assuming that the facilities are still having to have their, I'm not sure what you call them, but the patient meetings, for the care planning and stuff, and how is the designated family member involved in that?
This is Darlene Nadane, and I work with outreach and education with one of the programs is nursing home transition. The families that I've been in contact with would desperately love to be involved. The current situation is the nursing facilities just don't have enough staff to make phone calls. At this time, perhaps even a letter going out to families, just a form letter, I think would even help them feel connected. Most of them are saying, they've been calling and they're not getting return calls or they're being put off. So that's just one perspective. I know there's several different groups of families, but I think even just reaching out with a form letter, and if you have a contact person that can fit in a few phone calls, putting that number in the letter and allowing families, if you have specific interest in certain opinions or thoughts that family have, maybe put those at the bottom in bold letters and ask them to make comment, or even a return letter, because we're short-staffed. So just a couple ideas that I know people have found useful recently.
Those are great suggestions, Darlene.
This is Justina from TON Home Health in Farmington, Michigan. Facing so many communication challenges, even prior to COVID, we were desperately needing a tool to communicate better with everybody involved in patient care, the families, physicians, and throughout all the points of care. So we developed a HIPAA-protected communication app, and it was going kind of slowly in the first phase. I'm talking probably 2019. And with the pandemic, we realized that we had a great tool in our hands. And pretty much right now, we are testing it, and it looks like it has saved our operation. We are over 500 patients right now. What we have added to it is that the patient has an access to it, and also the caregivers who are willing to use it. And at the same time, even the physician. So it's a real time. At the real time communication, everybody has an access it's the families of those that are already using and are comfortable with it, they are thrilled with it because they have an access to what is going on between all the clinicians. The physician has an access to it, can have an input at the moment when the clinician is with the patient and the family can be far away in California. The patient is adding to it. It's a virtual app, so we can add the videos of the function or the obstacles to care. I can't even speak higher about the technology that was available to us, and we are able to use it. I'm hoping that it's going just to spread, that this platform of virtual communication and virtual almost charting, because it's a part of our electronic medical records too, that is just going to spread quickly. Thank you, if that helps. I just wanted to share.
Yeah, I think that's amazing. And I know your organization has always been on top of that within your staff communication and things like that. And it really did streamline things, but that's amazing to hear that now there's an app that's even spread more to the family members. And that is in the home health world, but still I could see how that could be adapted to other settings as well.
Yes, I truly believe that it could be adapted. It helped me tremendously. I'm a director of the clinical operations, so it helped me tremendously. I know what's going on with 500 patients just by clicking at this. At one moment, I'm everywhere.
Well, we have a question. What's the name of the app? Was it homegrown or external company?
Oh, it is homegrown, which is great because it's tuned. We had an internal expertise, so it's really it has a great smart features, like really intelligent features that are based on our knowledge and years of experience. The name is Home Health Notify. You can look it up. And I'm really recommending all those. I'm just not recommending our app, but all those apps that are available. It's just an instant communication.
And I think that is true. I think a lot of companies are developing things along these lines. And the other part of this, Jennifer asked, does it connect with Epic?
Not yet.
Yeah.
Not yet. That's the problem. We put all the referrals to it, so there's an access to the referral right away, but it's not interfaced with Epic yet. Again, because it was just developed pretty much during the pandemic stage. So as everybody, we went through all those phases, taking care of the growing number of patients and developing the communication as things were happening 24/7. But it's pretty much at the end stage right now.
Great.
You can reach out to me at any time. I can just probably help you out with any questions.
Yeah, that kind of connects with a question that I got. Would everyone feel comfortable if we shared a list of our participants with your email address? That way, if you do want to communicate in between sessions, or if you hear someone that has an idea that you kind of want to bounce your ideas off of, or ask more from Justina about their app, would anyone not feel comfortable? You can feel free to speak up now or shoot me an email. But if I don't get any of those, then next week I will make sure to send out that email that includes the list of participants along with their email address. I also just want to mention that we at Superior Health since March, we're doing some open sharing calls focused on COVID-19. We had some really good success finding both a patient that had COVID that was in recovery, and then a couple family members that lost some family members to COVID as well, that spoke and kind of shed light on what their experience was. So it seems like there are definitely willing people that will share their experience to help drive some of those policy changes. I know in that very first COVID patient call, the participant mentioned that she didn't have her phone with her. So she had no contact with the external world in this dark room, and having just her phone there would have made a world of difference. So just knowing those teeny little things can kind of make a patient stay a little bit better. I think just having that avenue that there is an opportunity to share will make a big difference in the patient or the family member's experience. And those are all on YouTube if you're ever interested in listening back to those.
Okay. All right, very nice, great discussion. And yes, I think if people are interested, I'm sure Justiana, there we go. It took me a minute, but I know you're always willing to share, and I know you'd feel comfortable sharing your email. So people can circle back with her and find out more about that app. I know it's a pretty neat app, but as she said, there are other ones out there as well that could really assist with communication in a very easy manner if people are just even minimally tech savvy. So it can be really great. All right, thanks. And then as always, yes, at the end of my slide presentation, which will go out, are resources and references for everything that I talked about today. So those are there as well if you're interested in finding out more information about a specific tool or communication strategy that I talked about today. With that, shall we move on to the case presentation for today?
Yeah, I know we're a little short on time, so we can run through it really quickly. And if we don't finish our conversations, we can maybe catch up on it next week if we need to.
Okay. All right. Well, I can also go through this at a very high level. This case presentation, some people might be very familiar with it. I sort of took it from a home health work group that I have worked with over a few years here at our quality improvement organization. So again, this is a mock presentation, not any particular place. All the, what do they say? The people shall name protected. So this is for Happy Home Healthcare. And what I, as a quality improvement person on staff there, found that for all the new patient intake forms received from partner hospitals, there was some information that was completed correctly on patients. Well, my goal was that we would receive all information and referrals from partnering hospitals, that it would be completed correctly so we could enter into our services and reach out to all patients within a 24 to 48 hour time period after receiving that referral. I wanted to work with the intake staff to understand their processes and what they did to accurately complete forms. I also wanted to work with them to review hospitals that were completing the forms correctly and what sort of techniques were used to gain that kind of compliance. And then my goal would be to form a tip sheet or transfer form that would be developed to increase the completion of information on referrals correctly. So the people I wanted to engage, in this instance, I'm the quality improvement manager. I wanted to engage the intake supervisor and the 2 staff who also did intake on a daily basis. How am I going to monitor that? I wanted to review 30 new patient intake forms from the partnering hospitals. Wanted to review the forms for completed fields and incompleted fields. And then I plan to track which referring hospitals provided information that for the intake form. And I'd create a report that would show complete and incomplete forms and those fields. And for the incomplete forms, I will indicate the areas that were not completed. And I will then engage the staff, the intake staff, to find out why those areas were not completed by the referring hospital. So some of these things I have not done yet, but the things that I'm concerned about happening is our intake manager really has been around a long time. She thinks they do things perfectly, even though sometimes referrals don't get processed very quickly. She doesn't like to change much. So one of my thoughts is to engage her in the process as early as possible and get the whole team together to figure out how we can implement getting those intake forms completed appropriately. And then I just had a few questions, challenges that I might have coming up, and thoughts if other people have tried to implement something like this. If you've ever had to improve on a referral process from any other organization, say outside your organization, and what did you do and how did you feel? Was it successful? And has anyone implemented a transfer form update with referring hospitals or other systems outside your organization? And then what departments did you find the most successful to engage with in that new process? Was it the discharge planning department, care managers, referring physicians? Who really did you target once you had your process developed? So those were some of my questions for today. I see that we only have a few more minutes. If anybody has any thoughts. So typically we usually figure out, does anybody have any other questions that they'd like to ask me to sort of flesh out my case presentation or anything before we get to the questions that I have? And with that, anybody have any suggestions for me on how to increase success of this project? Some thoughts on any of the answers to the questions I have?
This is Jenny. Nice job with the presentation. Is there any opportunity to automate some of this so that you can error-proof the fields, like refer them to a site or something versus a paper form?
Well, I work in a pretty small home health agency, but we're striving to move to that area. So if we could get the intake manager to buy into moving to an automated process, I think that that would be one thing. I know the 2 newer intake staff would be very excited about that. So if we can all sort of help her understand that that would limit duplication of efforts and miss fields, I think that's a great idea. Thanks. Oh my goodness. I see we're at the top of the hour. There's a great discussion after the presentation today. Really appreciative of that. I'm glad to be thinking about patients and families. I know everyone, once again, as we enter a very difficult time, exciting time with the immunizations and the vaccination. And then at the same time, still, I know everyone is struggling out there with the second surge. So I always want to just let you know, we appreciate you attending today. Hope you found some of this of value. Really thought great discussion about engaging patients and family members, even during this difficult time, how to re-engage them. All great conversation, and we're looking forward to next week as well.
Yeah, thank you, everyone. Our next session will be on December 22nd, and we will be focusing on using tools and charts. So we look forward to talking with you then. As Barb mentioned, with the exciting news of immunizations, vaccinations, if you do want to create a case presentation, we'd love to hear from you. It doesn't have to be for the next session. We have a few more after the first of the year that we'd love to hear from you from. If you want to try to flesh out your plan for getting your staff vaccinated or anything like that, feel free to reach out to us and we can walk you through that process for a case presentation. Thanks again, everyone. Have a great rest of your day.